ولما الدكتوره هاله قالت لي انت بتبص لي ليه؟ كان عشان الكلمه اللي اتقالت الستونز اللي عماله تتشال عشان تبوظ الكواليتي. احنا الجزئيه النهارده بنتكلم عن safety for high risk patients and quality reflection of health care. عشان نبقى متفقين انا دايما بتكلم ان الكواليتي ديت ليست تابعه من العالم الغربي ولكنها بتاعتنا. عشان كده بنبدا بسم الله الرحمن الرحيم وهننتهي باللغه العربيه بتاعتنا برضه. الحاجه الثانيه الجوينت كوميشن انترناشونال او الجوينت اكريديتيشن اوف ذا امريكان سيستم عشان نبقى عارفين اللي هي مور بوبولارايز هي الاقل بالنسبه لليوروبيه. عشان كده مشكله التامين الصحي في امريكا شالت راسها. يعني هيش ايديا عندهم الوت بروبلمز لحد النهارده. المشكله عندنا محتاجه زي ما اتقال قبل كده والاساتذه تفضلوا we need orientation, we need training, we need powerful governing ad hoc. لان هي دي عشان نحط policies and procedures. بالنسبه للحقوق الرسول عليه الصلاه والسلام قال هناك جار له حق وجار له حقان وجار له 3 حقوق. فاما الجار الذي له حق فهو الجار وله حق الجيره. واما الجار الذي له حقان فهو الجار المسلم له حق الجيره وحق الاسلام. واما الجار الذي له 3 حقوق فهو الجار المسلم القريب له حق القرابه او الرحم وحق الاسلام وحق الدين. صدق رسول الله. ليه؟ لان احنا بنقول الكلام ده احنا محتاجين تو هايلايت اللي عندنا. We have a lot of problems. والتشخيص زي ما اتفضلت الدكتوره امل بدايه العلاج. لو رجعنا لحقوق الانسان what is the human rights? As defined, it is a privilege given fundamentally to a human being as it is a human. And there is neither created nor can be abrogated by any government. الجزء الثاني it refers consider universal to humanity regardless of citizenship, residency, ethnicity, gender or other consideration. ده حق الانسان الطبيعي. زي هو لابس اللي مريحه using the high tech يعمل اللي هو عايزه. يبقى دي one of the points انك لازم يبقى لك حق كانسان. الobjectives of healthcare quality ان يكون عندي لما اجي اطبقها policies and procedures سياسات للتطبيق implementation that are implemented, documented and compliant مع Ministry of Health بتاعتي. If I use NHS system in United Kingdom or whatever the system I use it مع institutional rules and regulations اللي موجودة عندي في المؤسسة الصحية بتراعي I am not jeopardizing the patient health, moral, identity or beliefs. زي ما الدكتور هنا قال whatever his belief. If he is non-believer, I have to respect him. So I will start by some definitions. We need to know some definitions. What is the right definition? JCI كلنا عارفينها Joint Commission International. JCAHO is the Joint Commission Accreditation Healthcare Organization, برضه for the American systems, and الاثنين بيحطوا non-profit organization to accredit hospital systems. But I know I have to know in my situation and my institution I should have levels of care that can classify the health care we provide to any patient according to acuity of the patient or intensity of the service as emergency, intensive care or high-risk services and the general care provided. And we should have the integrated system that the system of the healthcare can provide several levels of healthcare in a certain group of patients within the same geographical area. ليه دي أهميتها؟ لأن I have to follow a standard. What is a standard? Standard is defined as applicability of an approach that has been validated in accreditation surveys around the world. And every standard, I have to get a measurable element of it. So this measurable element are those requirements needed for a standard and intent statement to be received and and assigned as a score during the accreditation process. يعني احنا بنتكلم ان the safety of the patient and patient rights of the high-risk patient is part of the indicators of the performance or standard. What is indicator? Indicator either is a measure of the performance of a function or a system or process over time that is continued, or a statistical value that indicates the condition or the direction of the performance or achievement of an outcome over time. But the measurable value, which is called the characteristic one, used to determine the degree to which standard is met or quality goal is achieved. لما بتحط في evaluation system or performance indication certain points that it can be reached the competence level about 50%, and we are planning to get the gap and cover it to 70% over a year, 90% over 2 years, so we are going to determine our measure variable. Like number of nurses certified with cardiopulmonary resuscitation in the emergency department. If I have 10% this year, I have to plan to increase later on. This is a measurable index or variable for indicators of healthcare performance. For the patient, in each part of the Joint Commission, what is in bold, that means it must be fulfilled. It is a core criteria. Other things are recommended, but it is not a core. Like exactly in the Egyptian system for the accreditation of this care. Almost only 20% is a core needed. The rest is non-core but recommended. So, to define a high-risk patient, it could be by specialty as a high-risk, as we can say high-risk patient for surgery, high-risk patient for anesthesia, or a general high-risk. Define at whom they need special care due to his disease, location, human age, or condition. And care of patient chapter denotes in the Joint Commission International that all care of the high-risk patient are told, are must. And this is, for example, if you take a sample regarding blood donation, the clinical guidelines and procedures are established and implemented for handling use, administration of blood and blood products. And blood should be administered according to the standards of practice and in a consistent manner in order to ensure the safety of the recipient. Therefore, should be in the clinical guidelines and the procedures described, documented and known, implemented and practiced by the healthcare providers. Recruitment from the blood bank, blood storage, patient identification, administration of the blood, monitoring of the patient, and identification and response if there is signs of potential transfusion reactions. So, what is by definition high-risk patient? As defined, high-risk patients are all those emergency patients, whatever the type, resuscitated patients throughout the healthcare facility, either inpatient or outpatient, patients receiving blood or blood products, comatose patients, patients on life support like ventilators, immunocompromised patients, if we have in our section, patients with communicable diseases, because they can high risk for themselves, for the staff, for others, patients on dialysis, patients in restraints, whatever the type of the restraints, is it physical, is it chemical, and vulnerable patients like pregnant women, like patients with dementia, elderly patients, or children below 5 years. Any patient undergoing moderate or deep sedation, patient receiving anesthesia, and patient receiving high-risk medications, or patient undergoing surgery. All these 14 groups, this constitute what is called high-risk patients. So if we take a surgical patient, we do a procedure under general anesthesia, it is a high risk for a lot of factors. He will receive anesthesia, he will get resuscitated during anesthesia induction and recovery. He is under life support, is ventilated. He is in a deep sedation, he is in restraint. He is in high risk medication, he is doing surgery added maybe his age group or vulnerable condition. So this is have a collection of the high risk. So what is the objective of our care? Mainly, as we all know, is high risk or non-high risk, safety comes first. Because first you have to save life, save limb or organ, and lastly you have to save function. So we have to be ready, as we are instructed by many of our instructors before me today. We have to plan, put our policies in procedures. With failure to plan is plan for failure. And as performance quality indicators, the main quality indicator in healthcare sectors depends on the high risk. Because we can omit minor performance in the outpatient clinic. But emergency care is one of the high quality indicators in healthcare service. Cardiopulmonary resuscitation, this should be needed. OR performance. All the intensive care units, whatever the type, and the hospital-acquired infection. Because in hospital-acquired infection, we have different groups, all in the quality indicators. Either nosocomial or intensive care unit related, or related to blood and the blood products, or with special sections. So we have concentrated this, the main indicators. Any healthcare facility have good performance in these ones, usually it passes in accreditation. In summary, because we have to be away from the reality, and all our work is given to Allah, the high-risk patients have some rights. This right is the right to be managed by a qualified individual, either a doctor, a nurse, a technician. The right to know and discuss risks, potential complications, and options of procedures or medication with patient, family, or guardian. The right to be managed according to clear guidelines and standard policies and procedures. And the right to be monitored during high-risk service. And he has the right to get complete documentation for all steps separately in due time. Because reluctancy and delinquency in recording is first-degree malpractice. And right to have different consent according to his risks and rights. Either surgical consent, anesthetic consent, whatever. Some patient may have 6 to 7 consents if he signs. Because the high-risk patients have 3 rights. Human right as a human, patient right as a patient, and high-risk rights as high-risk. And because it is the work of all of us together, everyone could achieve more. This is our team, and I end in Arabic. Shukran for listening.
بنشكر